just part of the ensemble.
That's funny.
Oh.
Yeah, I find it also helps outside when it's cold. One problem is wearing glasses is a real pain because it fogs up the glasses.
That's funny to say that. I noticed with my brisk walk, I kind of like having my mask on now.
Yeah, exactly. All right, I'm going to mute myself. So if anyone says anything dumb in the newsroom, I'm sorry, when people say stuff that's dumb in the newsroom, won't go over.
Good morning. Welcome to everyone. We want to thank Akila and Jay this morning for helping interpret. Vicki is not here today, so thank you, Akila, for joining us. Good morning and Happy New Year to everyone. As always, we're going to run through the numbers today. So in Hamilton County, we have had 54,379 cases of COVID-19 reported. 2,136 of those individuals have been hospitalized, and 421 have passed away. The increases from last week, positive cases is 3,852. The increase in hospitalizations is 72, and the increase in deaths is 10. So today we've got Commissioner Greg Kesterman with us, Hamilton County Health Commissioner, to talk about the numbers and the trends. And we have Dr. Rick Lofgren from UC Health. He's the president and CEO. We're going to talk about vaccines today. There's a lot going on in the world of vaccines, and we're going to try to organize our thoughts around what to expect here in the next couple of weeks. So as we turn to the new year, there are a couple things that I would like to stress and then turn it over. First, we're not out of the woods yet, and the vaccine is not being widely distributed yet, and so we need to continue to do what we know works. Wear the mask, socially distance, reduce your COVID footprint. Second, as the county will be focused like a laser on distributing and administering vaccines, we need to distribute not only the vaccines but information to people as to how to get those vaccines. So the vaccine is safe and effective. I think we're going to hear that from Dr. Lofgren. And you should get it as soon as you can. We don't know yet when the state and federal governments will make the vaccine widely available, but we are going to be standing at the ready when that takes place. As an aside, Mayor Cranley has convened meetings, and I've been participating in those meetings along with City Public Health, County Public Health, the Health Collaborative, the hospital systems, to make sure that we have a coordinated effort here in Hamilton County, that we understand our capacity, and will continue to build as that vaccine becomes available in larger quantities. Right now, we're getting, County Public Health is getting 500 doses a week. So that's not that much vaccine. That's not to say that Greg Kesterman isn't building capacity for more as we anticipate more coming to public health and our private partners. I mean, you know, so far what we know is that the hospital system is involved. There's the private sector involved through pharmacies. We've got city public health and county public health involved. So we've got a myriad of ways to distribute the vaccine, and my expectation is that we will all work in partnership to make sure that we've got a coordinated effort. But I will admit to you, I'll speak for myself, I'm a little frustrated that we haven't gotten more vaccines. here in Hamilton County to distribute to people that need them. So I think we've done a pretty good job internally with what we've received. We just haven't received that much. And so, health professionals are getting vaccinated, of course. Frontline workers, of course, importantly, are, as we've mentioned before, emergency responders in this community are getting vaccinated, but we need more. I get calls and emails every single day, especially from individuals over the age of 65, that are wondering when they can get the vaccine and get themselves vaccinated. I share the desire for people to get vaccinated, and I too want that information. We just don't have it yet. And so we all heard the governor say yesterday that in 2 weeks, we're going to start to vaccinate folks over the age of 65. We need that plan. We need to build the capacity here locally so that we are ready to go. We need to know what those numbers are. We need to know who's getting that vaccine and where it's going so that we are ready to go in 2 weeks when those vaccines become available. So we're waiting on that information. Commissioner Kesterman, myself, and the mayor all talk to the governor on a regular basis. And so we will be asking for those kinds of numbers because what we're getting right now, of course, will not accommodate the 1,200, it's 128,343 people over the age of 65 in Hamilton County. I mean, that's the kind of number we're looking at here, and so we are anxious to have a coordinated approach to this and anxious to get as much vaccine as possible here in Hamilton County so we can get folks vaccinated and safely move on with our lives once that happens in a widespread fashion. So that's what I've got today. I'm anxious to hear from Greg Kesterman and Dr. Lofgren. So Greg, I'm going to turn it over to you.
Good morning, and thank you, Commissioner. Over the last 7 days, we've started to see a slight increase in the number of cases. Our overall cases remain lower than what they were in mid-December, although I'm starting to believe that some of these case increases are attributed to Christmas, and it's still a little too early to tell if we'll see increases attributed to New Year's. So over the next 7 days, we'll be watching case counts closely, and we know that the cases do have a direct implication on our hospital systems. I'd like to remind everyone about the importance and availability of testing. We in Hamilton County have great access to testing. You can visit our website at hcph.org for details regarding those testing locations. In addition, Test and Protect is up and running throughout 2021. There are lots of opportunities to get tested. One of our team members got tested this week, and within 24 hours they had their test results. There was no wait to get tested, so please take advantage of this great resource here in Hamilton County. Let's look a little closer at the cases here for the county. I mentioned that on December 10th we saw our last peak of cases. We've kind of been declining over the last, since December 10th. Unfortunately, over the last 7 days, our cases have started to climb a bit. For the last 7 days, our average was 528 cases per day, which when compared to last week, we were at 380 cases per day. The week that included December 10th, we were at 716. So for reference, I just mentioned this week we're at 528, and December 10th we were at 716. So we're still not anywhere close to as high as we were, but that increase is a pause for concern or a reason for concern. There are currently about 9,000 known active cases in our community, so there is a lot of opportunity still to acquire COVID within our community. I say this really as a reminder that we still need to be extremely cautious with our daily activities. I know this is a new year. I know this is a year of hope because of the vaccine, but we are not there yet, and so we need to continue to be careful and continue to lower our COVID footprint. And if we go out and about, remember those safety measures that we've been talking about, which include safe distancing or social distancing, hand washing, and wearing that mask when you're in public places or in places where you can't be away from other people. Similar to our case counts, we are starting to see our reproductive number climb a little bit, which ties very closely to those case counts. Our reproductive number for today is at 1.21, and for the region we are at 1.19. So I would hope that we can start to see this number as well as case counts come down And as mentioned, now moving to hospitalizations, we know that these two metrics really closely tie to the number of individuals that are hospitalized within our county and region. Hospitalizations, as we know, are a delayed indicator, so typically it takes a couple weeks from the time we start seeing cases until we start seeing an impact on our hospital systems. When you look at Hamilton County, over the last month, we have trended down in the overall number of cases. We have between 5 and 10 cases per day over the last week. There was, you can see, a little bit of an increase for a few days in a row in Hamilton County, which does tie to the Ohio Alert System, so we'll be watching that closely this week as well. I continue to point out, though, when you look at the region's hospitals, we continue to be very burdened. This is on the bottom graph. You can see that we have not seen any decline in the overall capacity within our hospital systems. Our systems have not gotten the relief that we would like to see them get so that they can build some new capacity and have some room for new patients. There are about 750 people within our hospital systems. The intensive care units are also feeling that same burden and have not experienced any relief. And in fact, they've probably even seen a little bit of an increased burden. They are at about 200 patients within the intensive care units within our region. So just please continue to remember that we need to provide relief through our personal activities to help lower these COVID footprints. Moving to vaccine, the state is now in its third week of distribution with vaccine in the vaccine campaign. Yesterday marked the second week in Hamilton County for my team to begin doing the distribution. Our focus continues to be in 1A to save lives, as Governor DeWine again reiterated yesterday during the vaccine press conference that he had. And to this end, the push continues to be to get the vaccine into those that we know have had the greatest impact from COVID-19. So we're talking about healthcare workers, those living in congregate settings. And this work is well underway here in Hamilton County and throughout the state. Health departments across the state continue to work in an orderly fashion to get the vaccine that we're receiving out, and I've been very proud of my team as we do this work. This week we ran several vaccination clinics at our office and have been focusing on hospital, inpatient settings, and congregate settings that are not classified as nursing homes. So we've done a lot of great work this week, and we'll continue with our doses that we receive in the coming weeks. Everyone that we've encountered that is getting vaccine is super thankful and super excited. And I would just ask, with the minimal doses that we're seeing right now for patients from those that are anxious to get your vaccine, as we get doses, we will be reaching out to you, and we'll be working very hard to make sure that you have quick access to vaccine as it comes to our community. As Commissioner Driehaus indicated, we as a team at Hamilton County Public Health are continuing to build our model to make sure that we are prepared if we see even larger volumes of vaccine come to our agency. I'm really using a similar model to what we did with contact tracing, where I train a bunch of people and I'm able to scale it up in teams so that we have the ability to work across the county and to make sure that we have created equal access to all groups within the county. There are many, many partners as part of this campaign. We're still learning many pieces of the state's plan. I am not aware of the plan currently for Phase 1B, but I suspect public health and many partners will play a role as we get to Phase 1B in the coming weeks. So in closing, I do just want to say that we as a community still have to control COVID-19, and the three things that we have to do this are to wear a mask, social distance, and wash your hands. These are the tools that will help us keep people healthy while we wait to get enough vaccine to impact our community. Thank you.
Thank you, Greg. And I just do want to comment, I think you're being a little modest about the capacity of public health, because what I know is that we are getting 500 doses a week. We can do more. If we were to get 1,000 doses a week, we could administer those doses. And as we get more, we will ramp up and do more very quickly. So kudos to you and your team for being as nimble as you have been. We are at the ready to administer the vaccine, and I know the city is in the same position. So with that, I'm going to turn it over to Dr. Lofgren. Thank you once again for joining us, and we're going to turn it to you.
Thank you, Commissioner Driehaus. I appreciate you taking the time, having the time and opportunity to speak with you. I will maybe address some of the issues around vaccines, and if other questions come up, we'd be happy to address them. But I really want to reiterate and echo the comments that both you and Commissioner Kesterman made in terms of the coordination and the effort. At UC Health, as some of you may recall, we were actually one of the first 2 sites in the state to actually receive the vaccine, and we started on December 14th to really be part of that first 1A campaign to vaccinate frontline workers, the people at the highest risk of either acquiring the infection or, quite honestly, critical to taking care of patients who have COVID. Our rollout has been very smooth. It's gone extremely well. People have been quick to sign up, whereas each group that we identified to be vaccinated quickly fills our positions and our slots, and we were able to quickly vaccinate over 5,100 of our employees so far, and distributing 100% of the vaccine that we've received. In fact, one of the things that starts this week for us is that this is the first, we're starting to do the second dose of the group that was initially vaccinated on December 14th. They're now coming back for their second dose, which is really a nice landmark as well. We continue to hopefully continue to receive additional vaccine or product to allow us to complete vaccinating all of the 1A workers in our organization. I might also add then, quickly following, each of the other health systems have received their allotments of vaccines, and have also, I think, have done a really good job of getting it out to their workers. Again, the report throughout the region is that really what's the limiter right now is just the availability of the vaccine, the product of the vaccine itself. One of the things that we are anticipating is that I would tell you is that with the first round of vaccination, we saw really minimal side effects. We really had no problems with the vaccine in terms of it. What we do know is that people tend to have a stronger reaction with the second dose. That the studies report that people are more commonly will notice some fatigue and achiness after the second dose. This is really a marker that the vaccine is working. It's really your body's immune response that makes you feel sort of achy or fatigued. It really is an indicator that it's working. And so, but we do anticipate that with the second dose, we'll see some of that. But again, I think we've had, and I think throughout the region, it's gone remarkably well and smoothly. As you probably know as well, is that Ohio was a leader in trying to quickly vaccinate people living in congregate living. This has been arranged through the specific nursing homes and their arrangements with private retail pharmacies. That is, again, proceeding well, though there's been a little bit more hesitancy reported among some of the nursing home staff, both locally. And as Dr. Kesterman's mentioned, the county has been receiving this supply and has been busy vaccinating and individuals, particularly the EMS. You know, I think one of the things that I want to make sure that people understand is that, as Commissioner Driehaus mentioned, is that really at this point, the thing that is the limiter is the availability of the actual vaccine, that the organizations are prepared to deliver. The other thing that I will also mention is that, you know, I don't want anybody to underestimate the issues around the logistics that it takes to set up the vaccination program, about scheduling patients, registering them, keeping track of them. You know, these first two vaccines are complicated by the fact that they have to be refrigerated, particularly the Pfizer vaccine for super cold and ultra cold. And we need to make sure that we arrange that people get the second dose as well. So there's not an insignificant amount of logistics involved in terms of setting up all the infrastructure necessary to deliver the vaccine. I have been very impressed about the level of collaboration between the various individuals involved in the vaccination, between public health, the health systems, to really deliver that. One of the things that we've experienced, just to give you an example about the logistical elements, is that the notification about when and how much vaccine we'll get is really pretty short notice. So the idea that we might have the ability and product to vaccinate 300 people one day and 1,000 people the next day makes it difficult to get the scheduling pieces there. And that's kind of the elements that we're working through very effectively, and I continue to work through both at a state level and a regional level to really make sure we understand that. I think the other thing is that as we really start to get more and more vaccine available, and really recognize is instead of 120-some thousand individuals age over 65, this is a massive effort, and it's going to require all the elements of our healthcare delivery system working in concert. Obviously, some of the channels of distribution will continue to be the health systems. The health systems certainly recognize that once they get done vaccinating their own healthcare workers, that will start to work with our patient population and contacting them, working in close collaboration with the health department to make sure that we get vaccine and availability of vaccines throughout the entire community. Continue to work on retail pharmacy as well. I would anticipate as a couple of other new vaccines become available that require just one dose or may not require the refrigerations, that we might be able to use other sources to distribute the vaccine, such as physician offices and the like. So again, it's really exciting that we are at the point where we're really talking about rolling out the vaccine. I think it's very important that the community understands that these vaccines are safe, that they have gone, because the science was there before the pandemic, we were able to seize on what was already out there in terms of really rapidly developing an effective vaccine in a way that was, I think, really was impressive and probably even surprised some of the investigators on how well it went. And quite honestly, the data is really impressive about how effective it is as well. So I think that we really need to make sure that the safety issues there weren't any shortcuts in terms of making sure that this vaccine is safe, and the people that have been involved, including the investigators that you see, really understand how diligent and the process was in terms of evaluating the safety of it. Obviously, there's an urgency to get it out given the pandemic, but it is safe. And one of the things I want to make sure is that, as Commissioner Driehaus said, is that one of the things we really hope is that as we go through the priorities and the vaccine is offered to any individual, that they step up and take it. This will really, is what the community needs and really will help save lives. So with that, I'll turn it back to you, Commissioner Driehaus.
I think you just called me Dr. Driehaus. I think I just got elevated there. I can assure you I don't have the qualifications for that.
Well, I don't know. You've been teaching me so much, that it just came
Oh, my goodness. Well, now, that's very generous. So I again, just want to applaud the work, Doctor, that you are doing, Commissioner Kesterman, that you are doing. What we have received from the state so far has been distributed, and we're working through the phases as we should. What we're asking, I think, of the state, and the one thing, and you've both mentioned it, that we can control is the amount of vaccine that we're getting here locally. And so we're asking for as much as we can get, so we can get it in people's arms, and some predictability around that, so that, 1 week we get 500, the next week we get 1,000, the next week we get 10,000. There's as you have said, there are logistics that go behind that, and we just are trying to be as well prepared as possible, collaborating as much as possible, but we need some predictability from our partners at both the state and federal government. So we are anxious to do that work. We will continue to do that work and get this thing distributed as widely as possible in Hamilton County. So with that, Bridget, I think we're ready for questions.
Commissioner David Winter with Local 12 has the first question. David, who would you like to ask your question to?
Oh, why don't we start with Dr. Kesterman?
Doctors this morning.
Oh, sorry. Well, I'll just call you Greg.
That works for me.
All right. So, Greg, we just heard that there are 500 doses that are available per week for us here. Just doing the quick math, that would take about 40 years to get everyone at that rate in the county. Obviously, there's got to be more of an expectation than that. That's my first question to you, and perhaps dovetailed into that is the fact that back when they were doing the polio vaccines, We've all seen the news stories on them now. They had auditoriums. They had civilians being brought in to learn how to give these vaccines, and they had these mass vaccine plans, and they got it done. They got it done very quickly. What kind of plans do we have to not take 40 years?
I think the first part of that question, it's really important to remember that Hamilton County Public Health is just one small piece of the solution in Hamilton County. We just heard Dr. Lofgren indicate that his hospital system alone had 5,000 doses that they were able to get into their staff. Each hospital system, we have 5 major systems in Hamilton County, are in similar type situations. We also have 3 additional health departments and CVS and Walgreens. So 500 doses for me is certainly very small, and I would welcome seeing more doses here in our county for myself and the other health departments here. And the control that I have is truly within those doses, and we are working hard to make sure that we're scheduling appointments and getting it out to the community. The message that all of us are taking back to the governor is please send more to us so that we can continue to do good in Hamilton County. And I think, as Dr. Lofgren indicated, we will see more doses come as additional vaccines become available, as production ramps up, and we will do a good job with getting those out. As far as the distribution plans, I think the goal for the governor, as I have heard it played out over the course of several press conferences, is to utilize many, many partners in this vaccine campaign. Back when H1N1, which I have experience with, occurred, a large portion of the burden for vaccinating our community, at least initially, was put solely on the health department, and that model worked great. This time, we are prepared to take on that responsibility, but the truth is, my team and the health department teams around the state of Ohio have been working very hard for almost a year with the contact tracing campaign. So the idea of using many partners, I think, is a smart way to ensure that we are distributing vaccine and quickly getting it into the community. We have tools in place to vaccinate every member of the community that wants flu vaccine, and we're kind of going to use that same sort of a model, I think, as we get more doses of vaccine here in Hamilton County. The only other complexity I want to share is if you were to put a bunch of people into a large area, you do create risk during a pandemic, such as COVID-19, where it's airborne and people get sick from being around aerosolized particles from the virus. So what we are doing when we have large batches of vaccine, we are scheduling appointments, and so we're limiting the number of people that come around my team and come around each other to try and further minimize the risk of getting sick while you're getting vaccinated.
Sorry, one more question for you, Greg. Private care physicians have talked to us and said, hey, how about us? Why aren't we also distributing this vaccine for private care physicians?
They are absolutely part of Phase 1A. Public Health has focused our first efforts, realizing that I'm only in week 2 of having vaccine. I think that's a very important thing to not lose scope of. In the first 2 weeks, I have really focused my efforts on EMTs and paramedics, as well as congregate care. Those were the first 2 groups identified by the governor as having the highest risk of seeing an impact from death and more serious illness. We are absolutely working through some of those priorities, and as soon as I have vaccine, we will open it up. I have encouraged all primary care physicians that have reached out to our office to reach out to the hospital system that they have admitting privileges to and see if there's an opportunity to get in early with them as well. But please don't lose scope that we are literally in week 2. My first doses were received 2 weeks ago yesterday.
Okay, and then why don't we go ahead and, if I could, sorry, other reporters, let me just ask Dr. Lofgren then to follow up on that. And then I have another question for you, Dr. Lofgren. So Greg just suggested, Dr. Lofgren, that private care physicians can contact the healthcare groups. You would be one of those. Would you be willing to help out private care physicians at your hospitals?
Certainly will, and we, I think the issue that we look at in terms of first and foremost is the people who are within our health system. Now, most of our practitioners are part of UC, and they're very much, we vaccinated the physicians, we vaccinated medical students, we vaccinated nursing students alike to make sure anybody who's got contact has availability to be vaccinated. And part of that included all the ambulatory physicians and private physicians as well, so that as we start to get through our first wave of healthcare providers, including physicians who work in the community for us. We're very much vaccinating those individuals as well. Again, a large percentage of private physicians have privileges and with the other health systems, and I know that they're very interested in making sure they get their entire workforce vaccinated because they're in their hospitals as well, and so that they really need to be protected as well.
Okay, and then one more question for you, sir.
Yeah.
I talked yesterday to a nurse who told me that ECMO patients at UC are being turned away because there aren't enough ECMO machines. She said they're being sent to other hospitals. She said there aren't enough nurses to handle the influx of patients that you have right now, saying that people are waiting for pain meds that unnecessarily. They're waiting to be walked to the restrooms. She said there just aren't enough nurses right now at UC. What are your thoughts in reference to that?
I think that the issue about, as Commissioner Kesterman said, is that really the area that we're seeing stress through the entire region is critical care. So we saw a decrease in the number of patients requiring critical care in the middle part of December, and actually it's grown quite significantly. And that's where we're seeing the greatest amount of pressure. One of the things that we do at UC Health that's fairly unique is the ECMO. There is other ECMO capacity within the region, though. There is really the elements about providing that life-saving therapy that's important. One is actually having the availability of the lines to actually do the provided, as well as the staffing around it. And so that when we have multiple critical ill patients, as we did about a week or so ago over the holiday period, we really were exhausted our capacity to effectively and safely take care of those patients, and we did use and load balance and turn the entire region. And though I think that the issue about the increase in influx of patients in the hospitals are stressing primarily the staffing. That's really the rate limiter. It's not beds and it's not supplies. It's really the staff around it feel stressed. But patient safety and patient care is our number one priority, and we're always focused on that. And we really have plans to make sure that we are able to provide the kind of care to all our patients in a regular and effective way.
All right, thank you, Doctor. I'll yield my time.
With WLWT News 5 is up next, and he has questions for Dr. Lofgren and Commissioner Kesterman.
Yeah, Greg, you're at the podium there, so I can start with you. The governor has said he wants to get kids back in the classroom by March 1st. That's his goal. As we move to 1B, even though we have a long way to go for 1A still, will school employees get priority?
I will, at the local health department, have to yield that decision to the state. The state actually indicated yesterday during the press conference that details of that plan are still unavailable, and as soon as I have that information, we will share it and we will put it up on our website. But ultimately, we will follow the state's plan for prioritization.
And I know you can't control the amount of vaccine. Governor can't either. I'm not sure whose hand is on the lever for that, but what is your plan for immunizing 1B, or a realistic time frame? If we're only going to get 50,000 people over the age of 65 and in those other categories during the first week, and probably 50,000 for the next week, the time frame on this, it seems to me, extends deep into 2021, if not 2022.
So I think, as I mentioned previously, I think the truth is we have to see what kind of vaccine comes from other providers and to see what kind of an impact that will have on overall availability of vaccine here in the state of Ohio and ultimately in Hamilton County. Our plan is to make sure that we continue to get the vaccine that we receive quickly into arms so that we're making a difference, but we can only do that with vaccine received. So I am, at the end of the day, at the liberty of what the state is able to provide us here in Hamilton County. I really do want to stress, though, while my 500 doses do seem meager, there are many, many partners in Hamilton County that are receiving vaccine, and I think it's really important to count all of those doses when you think about Hamilton County. We have more than 500 people each week that have gotten vaccinated.
We hear from people who are, among senior citizens who want to know where the vaccine venues will be? You talked about you don't want to get a large number of people in one place, and there'll be a sort of a combo kind of thing. But have you worked out here in Hamilton County about where people would go and how they would be notified?
At this current time, we are using our clinic in Clifton to vaccinate individuals. So people are coming to us and they have a scheduled appointment. No different than if you were to go see a primary care physician. As we see larger amounts of doses available to my office, we will work with many of the communities that we serve. We serve 45 communities, and we have locations within many of those communities that have been designated as spots where we could do vaccination campaigns. Our plan is to continue to be flexible. We might use drive-up campaign efforts where people can drive and stay parked for 15 minutes after receiving their vaccine for observation, and we may use the inside the gymnasium but spaced out appropriately model as well.
Greg, 1A is not even close to completion, and we're told by the governor 1B is coming soon. Do you feel there's a disconnect here between the state and the counties? I know you guys work closely, you talk all the time.
So, I think when we start talking about 1B and 1A is not yet finished, I think it does create concerns for primary care physicians and dentists and the like that we have not yet gotten to. And hopefully, when we see more details about the governor's plan, it will answer more questions. But my goal continues to be to ensure that I vaccinate everyone in 1A within our jurisdiction that wants vaccine. I think it's critical that they have access to vaccine because 1A are those that are either highest at risk because they're in congregate care or because they are serving us as a population to help keep us healthy and safe.
Dr. Lofgren, just a couple of quick questions for you, if I can. The Surgeon General, is saying the rollout's not going well, and that we should not stick to the rules as to who gets vaccinated first. If you have medical staff, if you have people who are refusing to get the shots, is there something in place as to who goes next, who gets those doses, or what happens to those doses if staff says they're going to bypass?
Yeah, the way we've rolled it out is that we've gone through the prioritizations and we send out an emails where somebody signs up and they actually get a scheduled appointment. Our no-show rate in those scheduled appointments is very low. With the Pfizer vaccine, we actually found out that we could actually get more doses out of the vial than was originally believed, and so we were able to actually, rather than the 975, we were able to vaccinate almost 1,100 people. And we have a real prioritization. And so if there is vaccine available, we will actually call people in and have done that in the past so that no vaccine goes wasted, so that we actually have a way in which we can notify people if there's extra vaccine. Talking to my colleagues around the state, I know that that's exactly what everybody else has done, where if they have vaccines, they make sure they find and identify somebody. In a few cases where they just, at the end of the day or whatever, have extra doses, they'll make sure they vaccinate people, and it may be outside the actual prescription. But we actually have a very set way in which we notify individuals. They schedule an appointment. We are allowed to do that. Allows us to do that safely, as Commissioner Kesterman talked about, in terms of the spacing alike. And so that it's really gone, and it's gone quite smoothly for us in terms of that. So by no means are we ever going to waste a dose. We will identify somebody who is interested if we have extra doses available. Doesn't happen a lot, but it's happened some.
What grade would you give the initial rollout so far, if you had to give a letter grade to it?
It's interesting because I hear about how difficult it's going, and I would tell you that I thought for us personally, it's actually gone quite smoothly. Us to get out 100% of our doses has actually been something that's gone very well, and I think that's true for my other colleagues in other health systems. So I think in Southwest Ohio, I think the rollout has been relatively smooth, and really the limiter has been the availability of the actual vaccine. The other thing that happens, for example, is some of the logistical elements. Early on, for example, we were notified that we were going to get vaccine and had a whole schedule of individuals lined up, and then the vaccine didn't arrive. So, I mean, there's been a few of those hiccups in terms of that, but, this phase for us has actually gone fairly well, and have not experienced some of the commentary that I've seen around the country about the difficulties. And I think that Commissioner Kesterman, I think would say the same thing about, the issue is only having 500 doses as opposed to actually the rollout per se.
And, I've heard all the justification for this and all the arguments from the governor and from others. But how do you, be interested to hearing from you as a medical professional, how do you justify requiring medical staff to have flu shots when all the experts say coronavirus is 10 times worse than the flu, but not mandate the vaccine for medical staff?
I think that, and a lot of it has to do, I would tell you, is that we are still working under an EUA, and an emergency authorization as opposed to a full FDA approval process. And I don't want you to be bureaucratic, but it just does tell you that at this point it is new enough that I think it's difficult to mandate something that's still under an EUA. Once the vaccine becomes really very established and FDA approved, and it becomes part of just the way in which we do business, it may be in fact fall into the exact same category as some of our other immunizations that are required for healthcare workers. But at this point in time, it's new enough and under an EUA that I think most of my colleagues have said, it's strongly encouraged, but not mandatory at this point in time.
Thank you. Do you have any information from the governor about how soon, like tomorrow, will he, everybody's waiting for this, how 1B is going to roll out?
I think that I know that they're working diligently about sort of making sure that they have the logistics worked out and the like. So again, I think that we're all waiting for that, and I can tell you that there's a lot of active conversation and planning around it.
Thank you all. Thank you both.
Lean Almaderas from WVXU has a question next for whoever can answer it, including Commissioner Kesterman.
Great. So I want to just zero in on something, Mr. Kesterman, that we talked about last week, and that is when the vials are opened up. You told me that there's 10 doses in each vial, and if there is an extra dose, for instance, that somebody is found to receive that dose, Doctor, I think you told me or this something really similar. Is there anybody from the private sector? Is anybody monitoring how they are using their doses? Are they throwing away doses? Are they handing out doses in a different kind of way?
When you say private sector, are you specifically referring to the federal program with CVS and Walgreens?
Yes.
That program is monitored by the state of Ohio, and I don't have any local knowledge of how that process is working.
Okay, and so would any of you be surprised to hear that they are throwing a great deal of doses away? Would that be something that is news to you?
My understanding from yesterday's press conference with Governor DeWine, he became aware of an instance where I believe 35 doses were discarded. This was shared in his press conference yesterday. And as a result of that, he is creating a program where places that have doses that are about ready to expire are required to reach out to the Ohio Department of Health. And the state will then help try to distribute those doses quickly so they don't get discarded. As we roll out this new vaccine and in this novel pandemic, I think there are instances where errors can happen, but the goal is to quickly react to those errors and to make adjustments so that we are not wasting vaccine. That's our number one goal, is to make sure that every dose makes its way to an individual.
Right, and I guess so something I'm seeing on social media, and I think I sent you all a link earlier this week about it, is that we're hearing that in some of these pharmacies that people are announcing over the intercom, hey, we've got an extra 2 doses. If you're in the store and want a dose, you can come get it, right? And so I think we were talking about it in our newsroom and just wondering, should people be hanging around pharmacies in hopes of getting an extra dose like this, or are they all being allocated in a different kind of way?
I am personally not aware of this occurring, and I actually have not seen the social media of this nature. But my understanding is, at least with the locations in Hamilton County, they are being distributed in the most orderly way. Dr. Lofgren talked about a process. We're looking really to get the doses into those that fall into 1A, and when that can't happen, 1B, with the ultimate goal of making sure no dose goes to waste.
All right, and is anybody aware of any kind of, you talked about there being errors with 35 doses. Is there some kind of consequence for throwing away dozens of doses of this vaccine right now? I mean, I know in another state, and forgive me for not recalling the details, but I know in another state somebody was charged with tampering with doses. Is there anything like that with here in Hamilton County that you know of?
Anything like that would come from a state level, and I am not aware of anything like that at this time. I think everyone is truly working the best they can to get doses into people's arms.
All
The
right,
only-
thank you very much.
The only thing I might add anecdotally is that I do know, getting back to the coordination between the health systems and the retail pharmacy, in another zone, they actually had a retail pharmacy did thaw more than they actually could use, quickly coordinated with one of the health systems, and they got all those doses delivered. So I think everybody's keenly aware about how valuable each and every dose is, and making sure that we reach the highest risk individuals as we've outlined the prioritization. But in the end, and nobody wants to see this valuable asset resource go unused. And so I think there really is a lot of concerted effort to maximize every dose.
Thank you very much.
Our next question is from Chris Wetterick. He has questions for Dr. Lofgren or Commissioner Kesterman.
I apologize if this was at the top of the briefing. I was having some technical difficulties. Is there a number that you all have, either regionally or in the county, for how many doses that we have received total, that it would include Dr. Lofgren's system, all the systems plus the county, and how many have been actually distributed?
I am not aware of a one source for that number. It's possible that it's on the state's dashboard, which is on the coronavirus webpage. There is information about the number of doses that have been given out specific to counties. I'm not certain if it shows the total number distributed.
Okay, thank you. And then, Greg, this one's, I think, for you. I know we keep asking about stage 1B, and you kind of said earlier that it would be similar to how the flu, as we more widely distribute this, it would be similar to how we distribute vaccines for the flu. Does that mean basically, I mean, I got one at CVS for the flu. You could get one through your primary care physician. I mean, is it basically all hands on deck once this becomes more available to the general public?
So I think we're still learning more, and I think H1N1 versus this, we're looking at a different type of vaccine. This vaccine, as Dr. Lofgren highlighted, does have some more complexities with refrigeration and the need for second doses. I can tell you, though, in 2009, the initial distribution was put on public health, but then by the end of a few months, when we started to see significantly larger quantities of vaccine available in our community, it really did end up at all the CVS pharmacies and Walgreens and little clinics and doctors' offices, and just became one of those things that you could go get without much thought. And so I think as vaccine becomes available, I think the plan certainly will include utilizing many, many more partners. Dr. Lofgren also highlighted that a couple of the new vaccines that are getting closer to some sort of an approval also only require one dose and might be a little bit easier to manage. And I think as those types of vaccines roll out, the likelihood that we'll see more and more providers have vaccine available to get to the community will increase.
And can anybody speak to why there's been resistance at nursing homes from workers to get this vaccine?
I don't have any specific knowledge as to why there might be. I think generally we as a nation are slowly working to understand and accept this vaccine. There's always been hesitation around some vaccines, and I think that the truth is people need to understand that this is a safe vaccine and that this vaccine will help end this pandemic. I'm not sure if you have anything you'd like to add, Dr. Lofgren.
No, I think it is complex. The one thing I will say, though, that is information that we do need to share is that we firmly recommend that people who had actually think they have or have had COVID are to be vaccinated. And I know that's one of the questions that's come up in some of the nursing homes as well. But the
Thanks,
recommendation
everybody.
is to be vaccinated.
Okay, Ann Saker with the Inquirer has questions.
Thank you very much. Good morning. First, a question for Greg Kesterman, and then one for Dr. Lofgren. Greg, you know, there's been so much angst over this rollout. Is there any way this could have been done better? And if so, how? And what lessons can be taken from this early start? I mean, should there have been better coordination at the federal level in rolling it out?
So, you know, I said this earlier, but from my perspective, my team and the teams that I'm aware of in Hamilton County for what we have control over, we have done a fantastic job, and we are working as quick as we can to get that vaccine out. Unfortunately, so much is unknown about this virus, and as the vaccines rolled out, so little was known about the vaccines ahead of time. The day the FDA gave the emergency use authorization, we then got the fact sheets about what questions we need to ask. And, these types of delays do make it very difficult to plan a vaccination campaign, but I think the information in many instances is making it to the local level as soon as it can. And it's the complexity of the newness of this virus and the vaccines. I think the more information we have at the local level, the better off we will be. Commissioner Driehaus referenced a need for the state to get the plan down to the locals so that we can start planning. And the truth is, the more I have, the better off I'll be prepared, and the quicker I can turn around those doses. So I think overall we have done a good job at a local level, and I continue to be promised that we'll see more vaccine in our community, and we'll continue to make an impact on this pandemic.
Thank you. Dr. Loughran, I apologize if you mentioned this earlier. I came late to the party this morning, but I wonder if you could talk a little more about the situation in the hospitals, where we are right now, first week of January. Have you started to see anything post-Christmas that concerns you? What does the rest of January and February look like inside?
Sure. I think that just to highlight again, sort of what we saw if I follow the fall, is that we went from a nadir around the beginning of October of about 90 patients in the hospital, surged up to about 800 in the end of November. And what we saw in the month of December was we plateaued at that high level. We were worried that it was going to go even higher. It didn't come down, but it really sort of plateaued there. And what we've seen even after the holidays here is a little increase in the hospitalizations, and we're concerned that might portend or be a sort of the canary in the coal mine, if you will, about what we might see out of the holidays. So, coming out of Thanksgiving, we did better than we thought, but it didn't come down, but it plateaued. And so I think the biggest issue that we're seeing is is really an uptick in ICU care. So if you look again in that same time frame, back in beginning part of October, we had about 30 patients in the regions in ICUs, and we peaked up to about 175. But in December, it fell back down to almost about 140. But actually, since the latter part of December, we're up to about 200 in terms of the region. So that really is all I'm saying, Ann, is that we're seeing maybe the biggest push in the critical care elements for that. Now, the good news is that all the health systems meet on almost a daily basis, if not a daily basis, to look at whether or not we can load balance in terms of the entire region, as well as increasing the amount of capacity we have to accommodate the critical patients. And as I mentioned earlier, I think obviously one of the real limiters for us is just the availability of our staff in terms of that. So, but that's where we stand right now. I would say is that we've plateaued at a high level. We're seeing the biggest pressure points, if you will, in our critical care. And we're all sort of waiting to see what may or may not have happened as a result of the holiday season.
One more thing, Doctor, I'm sure you noticed, as we all did from over the weekend, that there were hospitals in Los Angeles telling ambulance drivers that if they had patients that were coded and probably not going to make it without a trip to the hospital, not to come because they were so full. Are you concerned we may get there here in Cincinnati?
It's my job to be concerned, so I want to make sure that y'all understand about it.
Sorry, go ahead.
I was just going to say, I really think the collaboration amongst the health systems so that we really can maximize the use of all of our resources has really gone extremely well since the beginning of the pandemic and continues. Each one of this health system has actually got plans about how they can expand ICU care in their own facilities. And so that at this point, I think, again, going back, I think when I talk to anybody, we're much as worried about anything as do we have the staff who are available to them and making sure that we always create a very safe environment for all of our patients.
And how is staffing? How tough is that now?
I think that staffing right now is that people are I would say that they're stretched but not overly stretched at this point. We're able to provide the care, but it is an area that we constantly look at how we're training up additional people to help support the teams. We have so that we can take advantage and deploy people who work in other areas and even ambulatory that can ultimately help provide inpatient care if necessary. So each one of the HIS health system is looking at not only the sort of the usual workforce, but what is sort of the reserve workforce that we can train up and be helping hands, as we call them, so that the team has other people available to help really spread their expertise.
Thank you so much.
And we have one last question from John London with News 5.
Just wondering if either of you have a projection as to how long it might take to vaccinate 122,000 people in this county who are senior citizens.
John, I think we have to wait and see what the governor's plan is and how he's planning to roll it out, as well as future allocations for vaccine in Hamilton County as well as the state of Ohio. So at this time, I do not have a projection.
Thank you.
Thank you. That seems to conclude our questions from reporters.
Yeah, thanks. And I'm just going to build very quickly upon what you just heard. So more to come on logistics. I think next week we are going to dive a little bit deeper on that. There is a lot of work going on behind the scenes with county partners, with city partners, trying to understand the logistics. But as you can tell, without any predictability about how many doses we're going to get and when we're going to get them, it's hard to build a logistic plan. It's hard to build the infrastructure because we don't know what we're looking at. And so we are anxious to get the plan. We're anxious to get more vaccine. We stand at the ready to administer the vaccine, both in the hospital systems and the public health systems and, the pharmacies. And so more to come on that, but without that information, it's very hard to do the work locally, but we're trying to anticipate. We'll talk more about it next week because there are a lot of different partners that are at the table. But what we need from the state is we need more vaccine and we need the plan. And so we are anxious to get that. Hopefully, more information will be available come next week. So thank you all for joining. Thanks again to the interpreters, and we'll be back next week.